welcome to The Point. Now, this evening we're going to be talking about the digestive system, all created by God, and the miracle of a digestive system. And I'm joined by Dr. Laura Richardson, who's a practicing GP, and she's going to be talking from a medical perspective about the digestive system. And we're going to finish up about what Jesus had to say about the digestive system and how it's associated with spiritual points that Jesus wanted to make about our digestive system. So I wanted to start off. Laura, I should have introduced you. How are things in general practice these days?
Great. Busy, but great.
Good.
And we thank God for it.
Now, when you're consulting on a sort of regular basis, how often do you come across people with problems in their digestive systems?
Oh, I'd say on an average day, where I see about 30, 40 of patients, at least a couple of them would have some problem with their digestive system.
And I'm sure later on you're going to tell us how we can live healthily and be careful what we eat and drink and the way we eat and drink and all the rest of it to sort of maintain a healthy digestive system.
Absolutely. The thing about digestive system problems is that a lot of them are lifestyle and diet risk factors. So if you have a good diet and make some changes in your lifestyle, then you are at much lower risk of having digestive system problems. Very few of them are actually genetic. It's mainly about our lifestyle.
Now, did you hear that? I need to listen to that very carefully too, about what we eat and what we drink and about our lifestyle. So there are a lot of very important points that Laura's going to be making just after this clip about how we need to be very careful about our lifestyle. Because God has created this digestive system, but we need to be very careful and not abuse our digestive system. Let's just ask Laura, how often do patients seem to abuse their digestive systems?
Oh, Richard, you're putting me on the spot there. Well, I would say that, to be honest, most patients who come to me, again, I see about 30 to 40 face-to-face on a typical general practice day. I would say that a good 3/4 of that is really to do with nothing to do with genes or mutation, but it's to do with what has happened, how people have, what they've done over the course of their lives, and then the payback. The body says, okay, this is what you did to me then, now this is what's happening. I think it's so important, really. What we do to our bodies eventually does have an effect on how well we are. But you know, I always come to the point of view that we are sinners and nobody's perfect, but we can do what we can to help with what God has given us.
Well, thank you, Laura, and we look forward to that part of the programme and Laura's going to tell us all about how we need to be careful with this amazing system that God has designed for us called the digestive system. So let's just have a look at this little clip and then we'll go back to Laura to tell us more about it. Hello, my name is Richard Kent. Today I want to talk about the miraculous digestive system. And I want to tell you that your digestive system is truly miraculous, designed by God, and is absolutely vital. We have a central computing system called our brain, which is more powerful than 1,000 NASA supercomputers. One of the many purposes of our digestive system is to extract glucose, sugar, from the carbohydrates we eat and provide the brain with energy in the form of glucose. If you deprive your brain of energy in the form of glucose and oxygen for 3 or 4 seconds, you will become unconscious. After 3 minutes, you'll be dead. That is how important your digestive system is. So let's have a look at this amazing digestive system. I'm not going to have time to describe all of this amazing system. We're just going to concentrate on the top half as far as the stomach today. When we eat food or drink liquids, it's propelled in our mouth and then down our food pipe, which is the esophagus, by peristalsis. Your peristalsis is actually very highly complex, and in fact you can drink a cup of coffee upside down. Try it sometime. Now, the whole process of peristalsis is a process of a wave of contraction and relaxation of the food pipe, the esophagus, so that a bolus of food or some liquid is propelled down your esophagus into your stomach. And it actually involves seriously complicated nerves with the release of adrenaline and acetylcholine alternately to cause a contraction and relaxation of the esophagus in peristalsis. Now, peristalsis happens throughout the bowel, but I'm just using the esophagus as an example. Now, there are two small problems on the way. In the larynx, which is about here, is the entrance to our lungs. And as we drink fluid and eat food, it's terribly important that food and liquid doesn't get into our lungs. Otherwise, we can easily drown in the liquids. Well, God has provided a valve called the epiglottis, which closes over the larynx so that food doesn't go into the lungs, and also a laryngeal reflex so that the larynx is tightly closed as soon as anything goes wrong. For example, if you were to swallow a fly by mistake, it's highly unlikely it would go into your lungs because your larynx would immediately shut very tight, so that the fly would end up in your stomach and not in your lungs. Now, the food is then propelled into your stomach, which is about the size of a large melon and can contain about 3 pints of liquid. The stomach varies in size according to how much you're used to eating, actually. Now, the first important thing you need to know is that your stomach is very acidic. It's about the same pH as car battery acid, a pH of 1. It's very acidic. So if a fly were to land into your stomach, it's instantly sterilized, which is why people don't normally get ill after swallowing a fly. Now, there are two things about all this acid in your stomach. First of all, it's terribly important that the acid doesn't reflux up into your esophagus, because your esophagus is made of different type of muscle with different skin lining, and the acid in your stomach would burn a hole in your esophagus if it was there. So God has designed this special sphincter called a cardiac sphincter to prevent reflux of acid into your esophagus. Now, the second thing you might ask is, well, why doesn't the stomach, which is so acid, why doesn't it digest itself? And now that is a very good question. God has provided an alkali on the surface of the stomach cells to prevent the acid also produced by the stomach cells from digesting itself. How on earth do the evolutionists think that that all happened by chance? Absolutely ridiculous. God is amazing and has provided for us an amazing digestive system. Thank you and God bless you. Welcome back to the Point. So that was just a little overview of the amazing, miraculous digestive system. We're going to pass straight over to Dr. Laura to tell us all about the digestive system, what sometimes can go wrong. And if there's time, we will come back to talk briefly about the extraordinary complexity, it's called irreducible complexity, of the digestive system. So Laura, tell us all from a practicing GP's point of view, all about the digestive system, please.
Well, thank you for that, Richard. It's, as you mentioned, when we swallow food, it travels down the esophagus by peristalsis, which is an involuntary movement, again created by God specifically for that. And let's take a look at this image on there. We've got the esophagus and we've got the movement of peristalsis, and we've got a bit of a piece of pizza there working its way down into the stomach. And when the pizza hits the stomach produces acid to start the process of digestion, in which it breaks down the pizza into its different components, the fats, the carbohydrates, so that we can get some energy through to be absorbed for the tissues in the rest of the body. And when all that's working very well, it's great. But the problem is, as you mentioned, there's a valve at the top of the stomach, and it's called the cardiac sphincter or the lower esophageal sphincter. And what happens is this valve is faulty and it doesn't close properly. So it allows very acidic, partly digested food and acidic fluid to flow back into the esophagus, which of course it's not meant to be. And we know that God has worked out a system whereby there are different mucosal linings. That just means the lining of a tube or a system. And each of the mucosal linings have different pH acidic environments that it will tolerate. And so there's some environments that are too acidic for the other environments. So the stomach, it's all right for the stomach to have acid, but a couple of inches away, we've got a valve that prevents reflux so that the acid contents do not aggravate and irritate the esophagus, which doesn't like to have anything acidic in it. Amazing. So one of the things I'm mentioning, which is quite a common problem, is something called GERD, which is gastroesophageal reflux disease. And on the left there we can see a normal esophagus. They've passed a scope down it with a camera, and you can see how the lining is nice and marshmallow pink, and it goes all the way down into the stomach. On the right there, we've got a highly inflamed, eroded esophagus, because the sphincter at the bottom doesn't close properly. As you can see, it's slightly open, and all this acidic, corrosive acid has refluxed back into the esophagus and has literally burned the lining of the esophagus, and of course this can't continue. So when a patient comes in, as I'm sure you've experienced in the past, Richard, when a patient comes into the surgery or doctor, they'll say, "Oh, I've got heartburn." That's one of the commonest symptoms of GERD is heartburn. Other symptoms are, they will say, "Oh, it hurts when after I've eaten," or "when I go to bed, I've got a sour taste in my mouth," or "there's a feeling like something is stuck in my throat." These are all symptoms that patients will complain about. Or they might complain of having a chronic cough, or even just having halitosis, bad breath. And the reason is just that stuff's coming back when it's not meant to. Don't want to be slightly gross, but we all know that when somebody regurgitates their stomach contents, aka vomit, it smells awful. It doesn't look particularly nice. It's got a sort of a porridgey consistency, and it doesn't smell nice, does it? Yes, so basically they go to the chemist, and what they would do is start with some antacid, and that's the best thing to do initially when people are getting heartburn. Most people don't come straight to the GP. They will do something first. They go to a pharmacist, get some antacid, and we've got some names. I'm not sure allowed to mention them, but the next thing they'll do is maybe try something a little bit stronger. So they'll start with an antacid, buy over the counter, then they might go on to something called an H2 receptor blocker. And of course, H2, hydrogen, chlorine, hydrogen chloride comes together to produce the acid, which is how the digestion process starts. And they might get an H2 blocker. Again, this can be bought over the counter. But they might find that after a few months, things aren't getting better, and they'll come and see us. And then we would actually, through the history, we may refer them to have an endoscopy, which is a camera down the throat, and we're talking about that later on. Or we may decide just to start them on what they call a proton pump inhibitor, which again will help to block the release of acid and therefore give a chance for things to heal. So prevention of GERD, weight loss, loose clothing, don't eat for at least 4 hours before you're going to bed, little and often meals for some people if they have to, and avoid fizzy drinks like tea, coffees, because they can trigger that, and avoid certain exercises, bending down crunches, for instance, because if they got a leaky valve, that would cause problems. Raise the head of the bed by about 15 centimetres, or the pillow slightly. Right. So Richard, that's irreducible complexity.
Well, I must say, that was amazing, actually, what you've just educated us all about, the how we can avoid getting reflux esophagitis, or whatever you like to call it. Is it still called reflux esophagitis?
Yes, yes, that's right, yes? It is. Yes,
good,
it is,
yeah, GERD, whatever. No, I'd just like to briefly mention about the irreducible complexity. The design of the digestive system is that, as I pointed out, it couldn't have evolved. It's impossible for it to evolve. Two obvious places is one, the epiglottis, closes over the vocal cords, so that any food or drink that goes down our throat doesn't end up in the lungs. If it does, we basically drown in liquids, or we have foreign matter bodies in our lungs and we get pneumonia, one or the other, and we will die. So that's one reason why evolution couldn't possibly have happened. Another, of course, is the actual acidity of the stomach. The stomach acid, if you've ever looked and vomit, it's actually very, very acid. It's about the same acidity as battery acid. Now, why is it that the stomach doesn't dissolve itself? Because God has arranged for the stomach cells to produce an alkaline to coat the cells of the stomach with an alkaline so that they don't get dissolved by the acid. Now, how on earth do the evolution explain that? I mean, it's just, it's just beyond explanation. Only God creates something so absolutely extraordinary and amazing that has to function correctly first time. It's called irreducibly complex. Back to you, Laura.
That's absolutely amazing, and that just brings me on to the next topic, which is about peptic ulcers. Now, 1 in 10 people over the age of 60 at some point might develop a gastric or peptic or duodenal ulcer. They're all the same thing. Gastric's in the stomach, duodenal is just outside the stomach, below the stomach as you go into the entrance of the small intestine. And basically a peptic ulcer is really an erosion of the stomach lining. And the reason for this is because somehow the way that God has created so that the defense mechanisms preventing acidic digestion of the stomach is broken down. And because of this, people get open wounds, literally open wounds and sores in their stomach. And I've got a picture of, fourth picture, of what it looks like with a peptic hole in the stomach, which I'll show you shortly. So the problem is that's a lovely lining of the stomach, as you can see. It has got different layers. When an ulcer develops, it actually penetrates most of the mucosal layers, so all the surface layers, and actually penetrates quite deep down into the layers of the stomach. And of course the result of this acid, which is burning the stomach, is the symptoms that people present which are central pain in the breastbone area. The pain can travel up to the neck, it can go right through to the back, or sometimes it can go down to the umbilicus. The pain usually starts for a few minutes to an hours, and it can happen after eating, between meals, it can happen the day or night. Sometimes it's associated with burping or with bloating. People lose their appetite, they get nausea, and sometimes they develop weight loss because they don't want to eat because there's so much pain associated with eating. And when things get really bad, a person might vomit what they call coffee ground vomit, which means the ulcer has corroded the lining of the stomach so much that there's bleeding, and digested blood looks like brown coffee grounds. If things get really worse, they may also develop tarry stools and lots of abdominal pain. So 1 in 10 people may develop this. It's usually common in the over 60s, and it's worse in men than in women, probably due to lifestyle. Men can sometimes be very busy. Well, what are the risk factors? One very important risk factor, and actually is responsible for at least 95% of ulcers, is this bacteria called a Helicobacter pylori bacteria. And the image of it, of this gross-looking, horrible thing, this monster of a bacteria, which is not very large actually, but it's really not very nice. And it lives in the lining of the stomach. It irritates the stomach lining, makes it more vulnerable to acid. There are other risk factors. So 95% of people 90 to 95%, the cause of the ulcer would be due to this Helicobacter pylori infection, which can be eradicated. A simple stool sample sent off by the GP will detect that particular bacteria, and they will be given what they call a triple therapy, which involves 2 lots of antibiotics and a gastroprotector. But other things that may predispose a person to gastric ulcers are the use of non-steroidal anti-inflammatory drugs. And some of them are over-the-counter, like the ibuprofen ones that you can buy over the counter. And people take them for headaches, they'll take them for arthritic pains, and for all sorts of things. And if these non-steroidals are taken for long periods of time and without taking something to protect the stomach, again, they can cause ulcers. And other aggravating factors like smoking, spicy foods, alcohol, may also predispose a person to gastric ulcers. Family history, smoking, age in the over 50 as well will cause a person to be predisposed to this. Let's have a look at what happens when somebody has a gastroscopy. This is a camera that is passed down with a light at the end. It's passed down through the mouth into the stomach. And this wonderful tool helps the people, the doctors, to be able to diagnose an ulcer and to be quite specific about where it is and therefore what treatment is needed for it. And basically that kind of sums up what 2 most common things can go wrong with the digestive system.
That's really wonderful, actually. Perhaps you just say one brief thing about alcohol, because I know alcohol, you did mention it actually, but can you educate us all a little bit about alcohol and drinking alcohol and avoiding stomach ulcers and reflux esophagitis?
Yeah, so alcohol is actually one of the risk factors for that, and there is a certain amount of limit of alcohol that we should take. There has been a revision on that, and it's now 14 units of alcohol, but generally I believe those figures are actually very high. Right. I think they're too lenient. I think a lot of people we see who have alcohol-related duodenal ulcers or other problems related to alcohol are actually drinking a little less than that. The liver, thank God, can tolerate a lot of alcohol abuse, right, because it's the liver that breaks down the alcohol. But in my professional capacity, the limit is 14 units of alcohol is a corrosive chemical to the stomach. Yeah. And really, if a person has a history of GERD or peptic ulcer, they really need to cut down the alcohol limit. So that's what
that's really
would say.
Wonderful.
Yeah.
Thank you.
Some people drink a lot more, but I wouldn't advise it.
Okay. And I believe you were going to read a scripture to us.
Indeed.
Laura?
And this is taken from Matthew 15, and it's Matthew 15, verses 17 to 20. It says, "Do you not yet understand? The whatever enters the mouth goes into the stomach and is eliminated. But those things which proceed out of the mouth come from the heart, and they define a man. For out of the heart proceeds evil thoughts, murders, adulteries, fornications, thefts, false witnesses, and blasphemies. These are the things which defile a man, but to eat with unwashed hands does not defile a man."
So there we have Jesus talking about the digestive system and saying that actually not what we take into our mouths actually defiles us, but actually what comes out of our mouths, all the bad things we say about other people, all the lies, all the blasphemy that comes out of our mouths, and all the other things. Have you got anything to say about that, Laura?
Well, yes, I mean, it's absolutely true. And Jesus was talking to the Pharisees, wasn't he? And he was saying that they were always trying to make him look one way or the other, were trying to trip him up, really. And Jesus is pointing this important thing, because they were very much focused on the laws of hand washing before eating and all the rituals. And the point is, of course, hand washing is important. It is good to wash our hands before we eat, but they were particularly trying to trap Jesus, weren't they? And Jesus was making them realize that, yes, you can eat this, but I've actually created a digestive system with lots of acid that can actually neutralize a lot of the bugs, and they can be eliminated. But what you actually speak, what comes out of your mouth, that really is an indication of where your heart is. Yeah. And Jesus was just trying to point out to them that, listen, you guys, I know what you're up to. And it's so important what we say. I mean, if you listen to a person long enough, you will know what they really think by what they speak and how they say it. Yes. You will get to know people just by listening to them. And we need to be careful. And if we find that out of our mouths, we're constantly being critical and constantly being judgmental, hate speak, etc., then we need to go to God and ask him to search us and use his word and spirit to cleanse us.
That's really wonderful, Laura. Well, I'm just looking at this. We've got just under 2 minutes left, and perhaps I can just finish by a proverb which actually says that death and life is in the power of the tongue. I'll say it again. Death and life is in the power of the tongue. So I just want to briefly tell you a true story about my wife. In the year 2000, she went blind in her left eye. She had a retinal vein thrombosis, and she went to a very well-known teaching hospital who took lots of photographs of the back of her eye, and she was told she would never, ever see again from her left eye. So that was really a bad thing to say to it was quite correct, actually, but it's not a very nice thing to be told that you're going to be blind in your left eye. But actually, Psalm 103 says something quite different. It says, "Bless the Lord, O my soul, forget not all his benefits. He forgives all your sins and heals all your diseases." So my wife is called Val. She said, basically, I've got a choice. I can either believe what the consultants have told me about being blind, or I can believe Psalm 103 that says, "Bless the Lord, O my soul, forget not all his benefits. He forgives all our sins and heals all our diseases." And unlike me, she wasn't remotely worried about her blindness and simply told everybody, "Don't worry about it, God has healed me." Now, at that point, God hadn't healed her, but she was confessing that God had healed her, because death and life is in the power of the tongue. So she wasn't remotely worried about it, but the extraordinary thing happened 9 months later. She'd been attending this famous teaching hospital, I better not say the name of it, for 9 months, and they were taking repetitive photographs every month. And on the 9th month she attended, and there she was, she could see perfectly. And the consultant was absolutely stunned and got all the other doctors in the unit to come and have a look at the photographs before and now. This amazing miracle had taken place, and now my wife could see. So there we are. Thanks for listening, and God bless you.